tell me what actually is social prescribing?
Well, it's a means of offering patients and people something that isn't a pill, a potion or a procedure. So it's particularly relevant to the 20% of patients that come to us with a social problem, people with long-term disease, we've talked about mental health, and those with the highest health risks. And there are just three elements. The prescriber, today a GP, but in future it will be consultants, it will be everyone in general practice, mental health, hospitals, and patients themselves. The prescriber refers to a link worker who is non-medical, who often has motivational training, can get under the patient's skin and understand what their hopes, their challenges, their blocks, their needs really are, really personalise what they need, and then refer them and often take them to a whole menu of interventions, which the arts are a really major part.
So, Martin, that's what social prescribing is. How does that fit into what are the major priorities in the care of older people within the NHS?
So there are increasing numbers of older people in society. That's a good thing. We're all living a bit longer. If you make it through today, you will live an hour longer tomorrow, on average. If you live in a more challenging...
Just think about that tomorrow.
Yeah, you can have your hour back. If you live in a more challenged part of the country economically, if you are in poor economic and social circumstances, you are going to do less well. So the challenges are twofold for me. One is to promote more active and productive ageing. When does ageing start? It's a continuous process throughout life, pretty much from teenage onwards. And the second challenge is to deal with and to address the needs of people who have not aged well, who have not fared well in life. And we know that in part that is related to the acquisition of long-term conditions. The more long-term conditions you have, the more likely you are to fare badly. And we know that whilst people are living longer and more people are living longer, there are also more people acquiring, as they go along, lost function and disability. And our challenge now, we've been very successful at managing long-term conditions. That's partly why we're all able to live a little longer in life. But what we've not been able to do is to push all of the lost function that might occur as a consequence of long-term conditions into the very last few moments of life. So achieving productive and active ageing whilst dealing with the consequences of those who've been less fortunate are the real major challenges that we face right now in health and social care, and indeed the whole of society. This affects us all.
And where do you think the arts can have the greatest contribution? What's your view of the arts in this particular field?
So I think the arts pervades the whole of society, and much in ageing is around not the fact that we do age, we all age, it's how we age. And I think if we are to achieve maximal well-being for individuals, wherever they happen to be in their life course, then the arts have considerable amounts to add. So we've already heard about choirs in care homes, fantastic idea. We know that kind of intervention, bringing dance into situations where people have lost the ability to move in a meaningful way for them, is a way of encouraging both productive, active ageing, but also of increasing community and engagement. Trying to get people together, we've, I think, in some ways lost in society the ability to communicate, to talk, and to value the people around us at times. And the arts, I think, are a great way of welding together some of those lost community values that we have.
Do you think that actually the medical profession is beginning to stop thinking of the arts as just kind of fluff on the top, nice to have, but not something that really can deliver hardcore benefits, if I can put them that way?
I would say yes. I think.
Hooray!
Of course I would.
Yes, you, I know you.
I may not make it out of here alive. Yes. I think. I think that the thing that we have been increasingly, the NHS is an extraordinarily successful venture. It's 70 years old this year. That's a massive tribute to the policy that took us along the journey that we're still on. But what we've tended to do is to engineer a health system that is reactive to illness. And I think what we've lost is the fact that many people don't suffer illness, but they do suffer isolation, loneliness, lost function, mental health disorder. These things get less well recognised. Ageing occurs in the background, as I've already said. And being proactive about productive living is something that I think the arts do. We don't spend our lives occupying ourselves with being ill. We spend our lives occupying ourselves with many other things. And the arts has much to add wherever you happen to be in the life course, as I say.
And a particular thing that the arts can do, I suspect, is get to people that are typically called hard to reach. So in communities that are perhaps not reached by other programmes, who are most disadvantaged.
Absolutely. So those are the people, if we look at the way populations age, we can count up the averages. So we count up the average outcomes of disease through things like mortality. But actually most of that burden of poor outcome is carried by the economically challenged parts of our society, the people who are less fortunate in terms of housing, accessibility. Worklessness, for instance, drives poor outcomes in terms of ageing, and accessing those individuals. And I think certainly the message to younger people in society is that there are old people wherever you care to look, and those older people have much to offer you in terms of life experience, wisdom, and I think engaging those people who are less accessible. One thing that I would certainly encourage anybody to do is to engage in a person who may not have social contact during the course of a day. We know that isolation and loneliness is, from a health point of view, the equivalent of smoking 15 cigarettes per day. It's as bad for you as that. But actually the intervention is very simple: social contact, whichever way that might occur, be it through singing, dance, engagement, through writing, watching and engaging with people who are able to entertain you.
So, Michael, there's this huge potential out here in the audience and right throughout the country. How do we grow the arts in health in the UK?
Well, I think we grow it by demonstrating its importance, first of all. And what we're seeing in social prescription is not only what you've just mentioned, which is addressing the inequalities, is able to get to the people who are least motivated, most in need of improving self-esteem and having input. But we're also seeing that you're getting some really hard outcomes. You know, if you go to Rotherham, or you go to West London, or even Gloucestershire, you're seeing 20% less GP consultations, 20% less use of hospitals. And this is what we need to be demonstrating in the arts. These arts interventions have some very hard outcomes in terms of reducing NHS expenditure, which I'm afraid is the thing that really appeals to the commissioners most of all. Besides showing that, we need to make sure the arts are seen everywhere. So we need to create a national index of arts interventions. We need to make sure...
Sort of an Argos catalogue of arts.
An Argos, if you go to
Yes.
Crawley, for instance, there is an Argos catalogue of interventions, and you can literally access it yourself or through social prescription. And you need to do that locally. So you need to be contacting where social prescription is happening. You need to be discussing with the link workers, with the CCGs, the local authorities, making sure that you're on the map there. Because going back to Simon's remarks about population-based evidence, which I totally agree with, but social prescription is also attracting a more personalised sort of evidence. The demand of the individual patient, and through personal budgets that will extend, to try out an intervention that they think will help them. And this is leading to a level of commissioning which is very much more person-based and much more particular to what individuals and societies are finding helpful. And if they can find the arts as one of many interventions that are really helpful, then I think you'll find that it takes off. And it will take off in some places faster than others, and then they can spread knowledge through that.
One last message from you to the arts professionals here. How would you like them to see interacting with the health service?
So I've already alluded to the strong messages around productive and active ageing, but I think also at the moment we are particularly challenged around dealing with the consequences of something called frailty. And we've been addressing that. We're the first country in the world to have addressed this assertively. We're proactively finding people with this condition. What is it? It's effectively the loss of resilience. And when it's extreme, people with that situation have significant needs for assistance with personal care, with function, with maintaining any kind of dignity. And I think that one of the key messages for me would be to engage with people positively around the frailty narrative that we're creating, to see it as a positive thing to find somebody proactively who may not be faring well in life, and to engage with them and to give them some more to their life in terms of quality, dignity, and to value them. And I think that that involves engaging with productively with care homes, with rehabilitation and recovery, with hospitals, with the health programs in a way that gives people a sense of value and positivity about their lives, even though they may have lost considerable amounts of function in their life. We can, I think, maintain well-being right the way through to the end of our lives, and I think the arts have considerable amounts to offer, particularly in those people who are not able, through misfortune or ill health, to address those needs themselves.
There's some clear pointers there, and thank you both very much for coming and talking here today.